Hello viewers and welcome to Salone Discoveries. Me na Asana Tolabelsila. Well, today the Discovery team Kawaka na Kande Drive by Wilkins Road. Also we can talk to Abibti Kamara, where happen for be the Chief Executive Officer for Social Linkage for Youth Development and Child Link. Abibti Kamara na possibly on the work with young people and people within the youthful age where it can to drug abuse business. Our people can tell we how we celebrate World Mental Health Day. World Mental Health Day na the 10th of October. People and think and say we need for come together, make we celebrate them people here because most people they go through stress, traumatic issues, family issues, some man they take drugs. We don't lead them for make them get mental health challenge or mental health issue. Over to you, Habib. Good morning and welcome.
Yeah, good morning, listeners and viewers. And me, Habibti Kamara, just like how they done into this week, Social Linkages for Youth Development and Child Link, and an organization where they work with drug users right across Sierra Leone on policies, on health, on human rights. So the World Mental Health Day will be the 10th.
Okay. So Habib, quickly tell me how your organization be quickly. What's the importance of World Mental Health Day? Why is the importance? Why then people are for be celebrated?
Mental Health Day is very important to we all. Everybody gets a mental health status, even you doing the correct well-being. Now, for that, the definition of mental health is the same definition of health. Anybody not complete stress is a mental health. Depression's not mental health. Some of when are professionals, then based on work with itself, they get stress, they get mental health with itself. So the World Fit and this year, the team was so nice. The team they say that if universal human right, mental health na universal human right, we cut across everybody right across the world. So this year, SLYDC.
Okay, yes. So you don't tell me the importance of World Mental Health Day. So when it comes to the celebration, how your organization been celebrate this particular day and why you decide for celebrate them?
We decide for celebrate them for raise awareness because we country the awareness of mental health is very lacking, and the way how we think about mental health in this country, we feel that people will they work on the street and they no more get mental health. We all get mental health challenges, and we raise awareness for governments for may they really take mental health issues very serious. Now that the mental health bill they in the process of passing to parliament. It already waited the parliament from a president put append in signature on it. We get for raise awareness and show the reality. And more especially, why make we celebrate mental health? We don't see an increase of drugs, more especially in terms of kush in this country. A lot of young people now they're on drugs, and the people that way they on drugs get a mental health related issue. We they provide psychosocial and activities then right now. This we office own and don't come visit we. So on that day we come up with media houses then for men can see waiting we they do. So on that day we provide health services for them. One more especially the key one was wound care. We all don't see that we young people the way they on kush, they most of them get so food. So tomorrow we the 27th, 9 at the closing date from the 10th to the 27th. We don't give free wounds care now. We treat them with wounds care. The one the way they come, and not to that no more. We do the wound care. We do HIV testing. We do a prep initiation. We do referrals, those that we test way positive, we refer them to and healthcare facilities them. We do TB screening, we do STI screening, and we do what we call psychosocial because mental health go to psychosocial. So for the past 3 weeks, this has been our activities in our drop-in centers, and we get drug users then within the kind of facilities for then for many can get them facilities then. So now this will they do, and we call the media houses them, engage them and pass with them around with facilities and show them waiting we provide to this type set of people. We are not only working with drug users, the vulnerable people, we call them key population, key and affected population. Drug users are one of the key affected population. Female sex workers, those that sell sex at night, and you have people in incarceration. We in our prisons, we get the LGBT community.
Okay.
So they work with them people there for provide health service, human rights for them, but we are not trying to advocate that their practice has to be legalized.
Because that will be something we will ask you, but we will come to that side. We'll come to that side quick. You make mention about the different treatments they wanna bring. Wanna do wound care, PrEP, TB screening, referral, STI, and cancer. So when it comes to the number of people that will be come for that treatment, because you say from the 10th to the 27th on a still a give opportunity to people the way they go through then kind of issues there. So how the turnout been be, or how the turnout really they go on from the victims them, then they come?
Yeah, then they come. It was very overwhelming. Yeah, for the past 2 weeks now, media houses and all they show waiting. We don't do it. That very day here was overwhelming because that day we do it with an incentive. Okay. Everybody that comes that day, wound care, we get an incentive in transport of 30,000. You know now how young people, we don't need, they not get anything.
So I wanna be able for get them.
We get a linkage. We get what is said. We get a sector or a department we responsible for outreach. We responsible of reaching out to them. And in the Western rural and the Western urban, we get what they will call peer educators and peer navigators, where they reach out to them, peers them, and move them. So before this, we have been sensitizing that this kind of thing they come. Reaching out to drug users for we in our heart. We have a drop-in center here. After here, we will go see the drop-in center and see the facilities where they provide, and it will be wide. Many people then see them, and many people then back we need the facilities there, despite the place far. If they see them, then we able come and can get them because a day for them.
All right, now na time for make we listen to Mustafa Killer. What happened for B, the needle and syringe exchange programs manager, and Seth Emmanuel Rogers, when are the programs manager for SECA this organization here. So waiting, then Seth gets for say.
The drop-in center actually we name them Safe Haven because most times drug users come need to know them for isolate themselves before they hide out. So get this drop-in center we consider as Safe Haven, wherein they will come and minimize the contact where they can most times place themselves at risk zones. So here they get multiple services ranging from HIV counseling and testing, PrEP, then psychosocial support. Psychosocial is very, very key within the drug community because for every human being taking up to drug use, there must be several factors responsible for that. So with the psychosocial support, most times so we can get them, we can able for at least able for diagnose or for identify which are some of the factors that will lead them into this. So the psychosocial wing actually is very, very effective, and we don't get a lot of testimonies in that wing. Coming to the NSP, the needle and syringe exchange package, now harm reduction package, we are we try for rollouts to drug users. People who are treated with drugs, more particularly injecting drug users, they use needles and syringes for injecting themselves. So the possibility for the HIV transmit from one drug user to another, now from the sharing of their syringes there where they can use. So now the harm reduction message will attach to these syringes is to ensure that if at all you can inject drug, they'll use one syringe for one person. Most times, suicide they can inject, they always share love. And for share love, maybe one dose inside one syringe, the one needle, 4-5 drug users, they use them. So one for discourage that, because now one of the factors is that they're responsible, one of the mode of contraction of HIV virus. And of course, recently, because of the huge health effects where this substance don't impose on the youth, and of course, by the wisdom of the executive director, we try to initiate something through the PrEP program. We are in the wounds where they get from then drugs intake there, we mend the wounds there as of now. So from the time and World Mental Health Day, from that International Mental Health Day, we don't begin that treatment, and up to now, a day as soon as they go somewhere, they see the clients we come for service.
Mustafa Kila, Naina, the manager in charge of the needle and syringe program of the organization, and Naina with flagship program.
These months alone are the highest number of drug users that we don't get, we don't visit the DIC since the inception of this program. There are more than 70 drug users we don't come at the drop center for treatment. And this treatment, we like now we initiate them. So like in that area for treat wounds of drug users, and not a part of the package, but we are appealing to the donors and other developmental partners for me to come in for treat drug users. Drug users, not to people that we for neglect. They are part of our community. If we left them astray, they go just like that. The pressure within the community. So I call on the international body for make we join hands together and the government. What we see say the drug intake among youths for be minimized, and also what we left for the attack, the one that we they take the drugs. We have the supply routes. I believe say if we don't cut off the supply routes, we say and say the drug, the tramadol, the coach issue will minimize, and we say the drastic use. It just started with tramadol can force. When tramadol can force will be cheap, then we see the negative impact it creates on the communities and on the lives of the youths.
The program manager, Mr. Emmanuel Rogers. We get drug users and female sex workers that they come for assets. They would say, "Now let me press." When you can, if not 10 or 20 you want, you press here. You push. You take how many condoms? Take how many condoms you want. Place that they do HIV testing, they do TB screening, STI screening. Charles Kumba na HIV counselor. We work at this facility.
Welcome back, viewers, to KID-AFAN Salone Discoveries. Me, Asana Labelsila. Don't forget to say the Discovery team, then a Wilkins Road by Kande Drive. Also, we they talk to Abibti Kamara. They tell we about how he celebrate this year World Mental Health Day. They don't tell we about the treatments that we then give to them victims them. Now it carry up more little bit on the theme where them pull for this year World Mental Health Day and several up more again part 2 or 3 treatments that we them been give because you will read the name prep, but waiting prep mean Abib. I want to make you up more small pan the theme for this year. How important this particular theme be to everybody across the globe?
Yeah, very important. That's why WHO, winner the World Health Organization, demand fit say this year theme for be a universal that say mental health na a universal human right. It is very key based on as a universal human right that it cut across all the globe, all the country. So for me government and for me stakeholders, then demand fit say it is a human right for everybody in the world. The team a very go down with we all in an activist them in the world for make we raise the awareness on that day for government and for major stakeholders then for more put hand under the mental health related issues now with various countries, more especially Sierra Leone. And Sierra Leone, we get the oldest and psychiatric hospital na Black Africa we have since 18th century. And they be call them a lunacy or a slave trade and a mental health institution for their slave the way they be the with. So Sierra Leone mental health related issue is not new to us. Since 18th century, mental health related issues don't count. The slave the way they be the with, they be get a mental health related issue. And now the mental health and after that they be call a lunacy center for them then slave the way they become with them. At Ibidigo, then change them to Kisi mental home. But now in 2017, 2018, they don't turn on now a teaching hospital, a teaching psychiatric hospital, which has improved thanks to the government and ECOWAS. They don't give the place a befitting with itself. Now we get they don't rehabilitate the place. They're one of the best clean hospitals right now in the country, more especially in terms of the treating those that has mental health, and they don't get a session for about 40 to 50 beds for rehabilitations of the one way they use drugs. And that was the government of Sierra Leone and ECOWAS now then do that facilities there for more get that facility. And we get another organization, we an American organization, is playing an immense and they play an immense role in terms of that mental health institution for Megro. We are PIH partners in health. So all medications then now we think that mental health related issues medications they now at free cost.
So you make mention about the different treatments they wanna be give to their own beneficiaries there. So people on the area the name prep. Waiting at the meaning of prep and waiting at some of the goodies way prep come with.
Prep na pre-exposure prophylaxis where they reduce the chance of a person get AIDS for people either from sex or injectory drugs, because you get AIDS or you get HIV through sex and injection. Why you get them through injection? If the person will don't inject you and share needles, you self way and don't share that needle. If that person get HIV, you self they get her. And that is the work we they do now. We in the SLYDC, with the government of Sierra Leone Ministry of Health, we they give out clean needles and syringes to those that they inject, because we don't want me then exchange that needle. They exchange that needle. The new incident or the new incident or the new infection, we want cut down the new infection rate of transferring the HIV by getting. Now for that we call a harm reduction. We reduce the harm from the drugs where they take in terms of needle. So PrEP, basically, as I tell you, PrEP na pre-exposure prophylaxis, na a drug or a medicine where you take, where it help you for prevent you for HIV. And again, it can lower your chance for me you not get HIV, and by sex and by injection. And scientifically 99% don't prove, hence you they use them, you know they get HIV. It only prevents for HIV, not STI. So now that na PrEP in rule where they do. So Sierra Leone, we they do the pilots. We don't start the pilots from last year 2022 to current. Now we want to scale up to the other places we in Ode. And the pilot, we are just doing the pilot for key population because they are more vulnerable. The key populations are drug users, female sex workers, people in incarceration, and the MSMs. So now then, a set of people there, the pilot we don't they go on with. But now, with the national HIV response, we want to scale up it to the general population because the general population self need them. Okay. So sooner or later, when I go see the response, the national response, billboards then will go out soon. There is an organization called JIPIGO, which is Global Reach, which is being sponsored by PEPFAR and the American President Emergency Fund for HIV, and the Global Fund. Now then they buy the medications way in the Canada country. It is new, but people want it now. It is on demand because it is the only prevention we will reduce you or we will make get chance for get the HIV, and it only prevents for HIV, no other things. But 99% of it has been and scientifically been approved that if they use them, break onto them, go get chances of getting HIV, will get HIV.
Okay, so finally, waiting now you message to every Sierra Leoneans when it comes to the intake of drugs. We don't see say kush na one drug where don't make name na the country pass a negative impact where any corner you go, any area you go, there people and they talk about drug, but kush. Morning Santa, you go see young man, young woman go thief something and go sell them because they want for take kush. Now people they think say, what's the solution? How we go able to tap kush business na salon? So as somebody we don't they work with drug addicts them, drug abusers them. So what's now you message to the general public or the world as a way or solution for tap the intake of kush or the coming in of kush or the manufacturing using of kush inside Mama Salone?
It is very, this has to be a collaborative approach and a multi-sectoral approach where everybody needs to put a hand on deck. And more watch the kush related issue as a community lens, as a community issue. It is by fitting that all communities, we know who side and they sell the kush within communities. But communities are playing lead services. It is by right that the government come up with a public emergency and put some stringent laws there in place. One, seizures of properties. Who side and they sell them places they are. Who side and they manufacture them kush they are. If we know the community needs to give a head up to the security. Make we see. Thank God. At first, police them. I used to blame the police. We blame them because we they see they kind of seize this kush. Later, we see back the same kush go from the same police back to the community. But now we don't begin to see one of the main targeted people who was well influential. They don't arrest them at this country, and now they can approach them. Let us, for me, the one way they use kush, they are patient, they are sick. Not of them will forgo attack. We for attack the supply route. The supply route is the only way. It is simple economics. If the supply is not available, the demand cannot be. If the supply is available, the demand goes for it. So, now the supply route, again, now they call upon government, more especially the Ministry of Finance. They have to budget the budget where NDLA, where the National Drug Law Enforcement Agency, and give out this CRC, now that they want for may they would save, may they support them, because NDLA is illy budgeted for from government in, government out. NDLA, we they call upon and then get the statutory declaration and then get the statutory right for what we call demand reduction. Therefore, reach that every corner in terms of sensitization and raising awareness in terms of drugs related issue. So now that I tell me people of Sierra Leone. So I tell una thank you for campaign for me una know what in SLYDC they do to young people in this country. I tell una thank you.
Well, as you don't help for discover this with me together, that na the different voices them from Abibti Kamara, when are the executive officer, Mustafa Kela, and Seth Emmanuel Rogers, where they all they talk how them celebrate World Mental Health Day, and Seth waiting at the different things the way they do inside this office here. So I want to say boku thank you to you for what you help for discover this with me together. Boku thank you also to we executive producer when our Dr. Aissatou Kakejalo, and Seth we camera operator when our Abubakar Tarawali. So till we go meet for another edition. Na so I go on for say tata member say me na Asanatu Label Sila.